Welcome to the next interview in the Oral History series, which is dedicated to highlighting the experiences and professional contributions of our senior faculty at NYU Postdoc. The goal of this project is to honor the professional legacy and history of our community. Today I have the pleasure of interviewing Dr. Judith Alpert, who has done many things in the field. I hope you enjoy hearing about her numerous contributions. So Judie, tell us how you got into the field.
Well, how I got into the field. When I was a sophomore in college, I went to Tufts University, which is in Medford, Mass. And by the way, I grew up in Massachusetts, so I didn't go very far away. It was Newton, Massachusetts, where I grew up. But anyway, I was a sophomore. I took this course called, and we all had the course in the field, Theories of Personality. And I fell in love with Erik Erikson. I just loved him. So I ended up writing a paper about him for the course. And then it occurred to me while I was in my dorm, hey, Tufts University is not that far away from Harvard University, and he's at Harvard University. In those days, we had the yellow pages and the white page. I can't remember if he was in the white or the yellow pages, but I looked him up, and there he was, actually listed. I was shocked. And I remember thinking, maybe God is listed. It was this incredible experience. So I ended up calling him, and he actually answered the phone. And I told him what my name was, and it was then Judie Landon, and I said, I'd love to meet with you. I'm writing a paper. I'm a sophomore at Tufts University. And he said, okay. And he said, when can you come over? And I said, well, you tell me what works for you. And he said, come now. And I said, it'll take me about 30 minutes by bus to get there, but I was ready. So I actually went, and I met him, and it was an extraordinary experience because, first of all, I learned stuff, but also he was so available, so accessible. Anyway,
Sounds great.
He was a psychoanalyst, so I decided this is an interesting field. But it just put it in my head because in those days, this is 1967. No, I'm sorry, it was 1963. Women, at least women I know, didn't become psychoanalysts. It just didn't happen. And in fact, when you graduate, you were supposed to have an MRS. And I failed at that. I did not graduate with an MRS.
Oh, that's a Mrs.
Yes, that's a Mrs. You were supposed to be married or at least engaged, neither of which I was. But anyway, I had this wonderful experience with Erikson, and I really felt good about it. And so at some point I went to Columbia, and I thought, well, I'm just going to get a master's degree because I can't get a doctorate. I'm a girl. And everybody was so angry at me and my family and my whole world, which was rather insular. People were angry that I was even thinking about getting a higher degree. So I ended up, while at Columbia, meeting Mary Alice White, who offered me an NIMH stipend, and I got a PhD from Columbia Teachers College. So that's how I began with psychology. That was the school psychology program. But that's how I began really with psychology, but I still wasn't thinking psychoanalysis. And I wasn't thinking psychoanalysis because I became a feminist. And that was a little bit later. But things were brewing. I was becoming interested in feminism. What happened was this was 60, but now I'm up to 19. I went to Columbia at 1960. I graduated from college in 66. So I began Columbia in 67. And I was at Columbia from 67 to 73, basically. So then what happened was, this was 1967.
Yeah.
And I ended up at Columbia, but I did get married a year after I graduated from Tufts University. I got married. That was 1967, and my husband was at Yale Law School, and so I ended up spending a couple of days in New Haven, and then a couple of days in Columbia. And I remember taking the 6:01 train. I mean, it's really incredible as I think about it, but I would take the 6:01 train to get to my 9 o'clock class at Teachers College, Columbia. And it was crazy, but I did that for, I guess, 2 years. And then after that, I was fortunate because I interned at Yale University at the psychoed clinic, and that was with Seymour Saracen. And that was a wonderful experience. And it was wonderful because I learned so much about teaching. I still haven't told you how I got into psychoanalysis, but Seymour was very psychoanalytically oriented. And he applied psychoanalysis to settings and organizations. It was really unusual. And I learned a lot about teaching and about people. I mean, we had these...
This was an internship?
This was an internship. It was really incredible. I was in a different setting every day, 4 days a week, with a different supervisor, working quite differently, actually, in each setting. And then the 5th day, we would all be together. There were only 3 interns, but we would all be together in a room with a number of faculty. Bert Blatt, I think once Anna Freud even came, who was at Yale at the time. And Missy Seymour was there, and there were Ed Trickett and Dick Rapucci. These names probably don't mean anything to you, but they were really quite wonderful people. And Seymour had this rule on those Friday sessions, and the oldest person was the last one to be called on. The most senior person was the last one to be called on. The most junior was the first to be called on. He really communicated something incredibly important about how you interact with students, what they mean, giving them space to be able to talk about what was important to them. He was really quite extraordinary. Mm-hmm. So this was in '69, but there was something else that happened. The feminist movement was starting to brew a little bit. I was starting to get angry, and I really began getting angry. Seymour, I went out for, I guess it was around Christmas time with the other interns, and I found out that they were being paid $3,000. Again, this is 1969. I was being paid $2,700. I was horrified when I found out. And how I found out was we all went for a drink. I said, my God, this is part of our salary. We don't have much left if we have this drink. I'm kind of joking. And then I said, then somebody said, your $3,000 doesn't go very far. And then, what, $3,000? I'm only making $2,700. I just decided I made less because I must not be as good as they were. And so I was really concerned. Finally, I got the courage up many months later to ask Seymour about it. You know, he was a product of his time, as we know Freud was. And I said to Seymour, how come I'm making less? And he responded, well, you have a husband to support you. Oh. And that's what it was like in those days. So I said I really didn't, but anyway, he was able to adjust my situation, which I appreciated. Yeah. But this was 1969, and there was so much sexism at the time, and I was feeling overwhelmed by life because I was commuting. I was very thankful to my husband who let me commute and go to school because this was extraordinary. So I was commuting, coming back to a house with dishes piled up to the ceiling and laundry and all his friends to entertain, and somehow I was supposed to get work done. That's the way it was in those days. At least it was in people I knew. It was a very different time in history, 1969. So I joined the New York Radical Feminists when I moved to New York City. And when I moved to New York City, I know the question was, how did you become a psychoanalyst, or how did it happen? But when I moved to New York City, I looked for a job, and again, it was the Yellow Pages. I applied to every school I could find, because I didn't have my degree yet. I still had my dissertation to write.
But you knew that was where you wanted to move toward.
Well, I was in a PhD program, and there was no question that I was going to get my PhD. Yeah. But I had to write the dissertation, and I needed to make some money. I wasn't committed to teaching, but I thought that was a good thing to do while I got my PhD. And so there I was at looking for a job, and I got a position at Marymount Manhattan College, which is a small Catholic women's college. It was actually a quite lovely college, and it was all girls. And I was given a couple of courses to teach, but I was asked, what else would you like to teach? And I said, psychology of women. I didn't know of a single course in psychology of women. It didn't exist at that time. It was, to my knowledge, the first course in the country in psychology of women. And there were no books to use. I found 2 textbooks on psychology of women, but that was it. So we used Freud, we read Freud, and we critiqued Freud. I was getting angrier and angrier. And I'm telling you how I got into psychoanalysis, but actually you could see how I would get out of psychoanalysis because I was so angry at how women were depicted at that time. So Freud was some of what we looked at,
Uh-huh.
and in this course on first course on psychology of women.
Mm-hmm.
Anyway, eventually I got my degree. I joined the New York Radical Feminists. I became somebody who marched. Appeared on the front page of the second section of the New York Times because I had a baby on my chest as I was marching. My baby was born in '71. But I was very involved in the women's movement, not interested at all in psychoanalysis, but very tortured because I felt, how can I work? I want to work, and yet so many people were saying women can't have serious careers. What are you doing with having a baby and going to school and getting a doctorate? You can't do this. It was 1969, 1970. How can you do this? And then the women in the playground, there's so much tension between women who had babies and women who didn't have babies. So much tension between women who had babies and worked and women who had babies who didn't work. It was really a hard time. So anyway, I really wanted to be in treatment. And I had such a good experience with meeting Erik Erikson, and I realized I knew two people who were psychoanalysts also, who were wonderful. Somebody who helped my father when he was sick, not in treatment, but really a friend of mine's father was a psychoanalyst. I didn't know he was at the time, but I found out later, someone else. Anyway, I really began to feel good about psychoanalysts, and I found somebody at Postdoc who was a woman who had a child. Actually had a child, but the child was 13 and she was working, so I was thrilled, found somebody. So that's how I began. I don't know if that answers it.
So
but
you got into treatment with the psychoanalyst before you actually entered psychoanalysis.
That's right.
The postdoc, rather.
That's right,
Okay.
Yeah. And then once in, I was hooked.
Okay.
Okay. And so I decided at this point, I was totally hooked. I started supervision because I was also seeing patients, and I started supervision at some later point. Okay, so I started postdoc in 1978, and at that time, there were two tracks. There was the Freudian track and there's the interpersonal track, and there was incredible tension between the two tracks, and there was a lot of pressure for the candidates to join one of the two tracks. And faculty were fighting over the candidates, kind of putting a lot of pressure on them. So if you were in treatment with an interpersonalist, that person tried to get you to join that track. If you were in treatment with a Freudian, there was a pressure to join that track. I remember at that time thinking this didn't make a lot of sense because I wanted to be in both tracks, and I wanted to learn as much as I could. I ended up being supervised by Avram Benavi, who was wonderful. Say Basescu, a number of years, who later became a friend and who I went to Paris with a couple of other people. It was really a lot of fun. Ruth Jean Eisenbart, who was a Freudian. So I had interpersonalist and Freudian. And I saw Ruth Jean for a lot of years for supervision. But I identified with what was called the independent track. And the independent track was a track, everybody thinks the independent track means, I don't know what they think, actually, I shouldn't even say that. But for me, the independent track was really a track where people did not want to associate with one or the other, but really either wanted to be eclectic, wanted to have knowledge of all of them, wanted to be unaffiliated, or felt that those two tracks didn't meet their needs. In other words, maybe they were Jungian or something. But for me, I really saw myself as somebody who wanted to take from the interpersonal track, from the Freudian track, and in addition, I was in a study group with Steve Mitchell, so the relational track hadn't started yet. It didn't exist. But I had experience with Steve Mitchell, and so by the time I graduated, I don't think the track had started yet. I graduated in '84, and the relational track hadn't started.
The relational track was 88.
88, okay, so it had,
So I want to ask you,
Yeah.
when did the independent track come to postdoc after the relational track, or was it before?
Oh, no, way before.
Way before.
In other words, there were these two tracks.
Then the independent, and then the relational track.
And then the independent, yeah, and then the relational.
Okay.
But I couldn't even consider relational because it didn't exist. but I did know Steve Mitchell, and I did study with him, so I wanted to do that. And what I liked about the independent track was you could somehow put it all together. I mean, I like to think of myself as walking around with a basket filled with lots of different orientations or different ways of thinking about problems, and you pull out what the patient needs. So I think of my orientation as being Judaism, and I spell my name Judeism, and so I saw what I did as really kind of putting a lot of different things together, and letting what the patient needed pull from what I had in my basket, sort of, what I could offer that patient. So, for example, I had a patient who was in the field who never had play, never played, never had a childhood really. And so she entered treatment when she was in her 70s, and we really did play therapy. And it was lovely, and she really thrived with that. It really was important. So I like to think of it as we are people who've had a long life. We have a lot of experience. We've had a lot of different supervisions, and somehow we put it all together in this basket and walk around. And when we see patients, we don't have to give. If we're Freudians, we can do Freudian. But if we've had a lot of exposure to a lot of different orientations, we can somehow pull together what we think that patient needs. So that's kind of how I conceptualize it. I was always in study groups, and there were mixed study groups, meaning there were people with lots of from different orientations within those groups.
Is that also true with Steve Mitchell's group?
The relational didn't exist at that time.
But so it was a mixed group.
So there were Freudians and there were interpersonalists in that group. Yep.
You know, Judy, you're so well known for your work in the area of trauma. In particular, your work with sexual violence. Tell us about that journey you've taken. Tell us about your work.
Okay. Well, I'll begin by telling you how I got into it. And basically it began from the women's movement and from teaching psychology of women. And psychology of women at some point focused on violence and violence against women. And then we learned about sexual abuse. And people didn't seem to know it existed, didn't believe in it. They said sexual abuse can exist. People were denying it, and obviously it was very much an issue. And for me, it began with a patient I had who had a memory of sexual abuse. She knew she'd been abused. She had her father attempted a lingering kiss when she was about 12. And then she always knew she was sexually abused, and finally she left home. But she had no memories except for that one lingering kiss. And then she came to see me, and I was really concerned because it was the beginning of some concern around false memory and people planting memories. And so I was very careful about that.
Right?
Therapists. And, people were so angry at therapists. First of all, in the American Psychological Association, people hated psychoanalysts. They hated clinicians, and they hated psychoanalysts even more. And then this whole issue of the false memory syndrome made us very disliked. The scientists really won out. They were seen as the people who were not, they were seen as the people who were right, that we were planting memories in people's heads, and somehow patients were not sexually abused, but it was the therapist who said, you were abused, and this is the memory. And somehow they couldn't entertain the thought that maybe that rule applied to them, that maybe a father said to a child in the middle of the night, this isn't really happening, you are not being abused. I mean, there was none of that. So I was involved in a number of cases around sexual abuse. You asked how I got involved in the whole sex abuse world. And I mentioned first I got involved because of women's stuff, psychology of women, and you can't avoid violence if you're looking at the women's literature. But there were a number of cases that really got me very, very engaged. One was just a patient who'd been sexually abused, and she knew she'd always been sexually abused, but she only had one memory. And this was, you have to put it in context. I mean, now we all know this. This is so clear to us. But at that time in history, and this was in the, I guess it was the 70s, we really had no knowledge. We had no knowledge of this at all. And so was this woman sexually abused? Was she not? She certainly had. She was symptomatic. She clearly felt she was. So I began to work with her on it. I wrote a bit about it. I made some changes in the case so that I was able to write about it. But anyway, suddenly the False Memory Syndrome Foundation got involved, and APA was very concerned about the fact that psychologists were on different sides of the same issue. So, for example, sometimes people would be in a courtroom and somebody would say they were sexually abused, and there were psychologists who say, yes, she was sexually abused. We have a lot of data which would support it. And somebody else a psychologist who was a scientist would say, no, she wasn't sexually abused. You can't believe it. Therapists have been planting ideas in people's heads. And it was so tense at that time because colleagues were talking about people marching outside their apartments, outside their houses, with big signs saying she claims she's sexually abused and she's not. This is a child molester. Or there are just all kinds of accusations against the psychologists who were supporting the patient who'd been sexually abused. APA decided to establish a group to investigate the issue of recovered memories of sexual abuse. It was called the Investigation of Memories of Sexual Abuse. Elizabeth Loftus, who was a scientist, major scientist at the time, was on the committee, as was Chris Courtois, who was a practitioner. I was on the committee, and Laura Brown, who's also a practitioner, and then there were Peter Ornstein and Stephen Ceci. There were 3 scientist practitioners and 3 what I'll call scientists, cognitive scientists, or memory specialists. And I was co-chair of that committee. I felt that was the most difficult experience of my life. I felt like I was locked in a room for 4 years. It really wasn't that way, but maybe about 3 times a year for a couple of years, we'd go to Washington, D.C., and we would be together for a weekend, this group, and we'd spend the entire time working on trying to develop a position for APA around recovered memories. And we couldn't quite agree. We weren't able to agree on really anything. So in the end, after 3 years of working, and working in between these meetings as well, we ended up developing a position paper which APA would not accept. It was supposed to be published in the American Psychologist. APA would not accept it. And so we ended up writing basically 6 papers. One is the practitioner's position, the scientist's position, their response to us, our response to them. Anyway, there were a bunch of papers, and that was published in a major journal of law, public policy, and psychology. And from that experience, I got a lot of phone calls to be an expert witness, which I did do. And it was fascinating work, and I really recommend that people do this. By the way, most of my career is really seeing patients, but this was like a side, and I think it's important to mention. I got involved in some very interesting cases, and what I really feel so good about in terms of these cases was it gave me an opportunity to educate a jury. And I could educate a jury about dissociation, about sexual abuse, about memory, about traumatic memory, and how traumatic memory is different from normal memory. So this was a very important experience. I've been involved in, I'll tell you about one more case, and then I think another case was fascinating. Again, this was in maybe the 80s, where we knew so little about traumatic memory. There was a woman who had killed, I can talk about this because I've disguised it, a woman who killed one of her 5 children, but didn't kill the other 4. And she killed her slowly over time. And the question was, why did she do this? And as I talked to the woman, the mother, I learned that this child was a product of rape. Oh. And it was really a dissociative event. And when I say slowly killed her, she really very slowly killed her. I can't say too much about the case, but she slowly killed her. And it was a horrific case. But it made sense. You know, the woman had totally dissociated. It really made sense why, but nobody understood what happened at the end. In other words, the public did not understand psychology. They didn't understand psychoanalysis. They certainly didn't understand dissociation, traumatic memory, why children work so hard to forget, why adults work so hard to remember. None of this was understood at all.
did all this work impact on you, Judie? You know, I'm hearing that
Yeah.
you're very happy that you were able to bring these psychoanalytic ideas to the public. So what was your experience doing this work during these years?
Oh, it was really, really difficult. It was really difficult. It was exciting and interesting and overwhelming because I was so busy with all of this.
Mm-hmm.
But it was very, especially with the bus case and meeting with children. I met with 20.
Tell us about the kids.
Oh my God.
Yeah.
That was really hard. I met with, and this case is disguised as well. I've written about it, but disguised. I met with 20 children who were sexually abused on a school bus from 1 to 3 years. And
Of
it was
age?
1 to 3 years that they were abused. They were ages 5 to 10 at the time of abuse.
Uh-huh.
And I knew it was going to be hard. So I had a doctoral student who was working with me on her dissertation, and I had her sitting in with me. And she was terrific because she would talk to the young people. You know, they were at the time, they were 10 to 15 when I met them, and she helped me a lot, and then we would process out everything afterwards. So we kind of got through it together, and I'm very thankful for her. But it was hard. For example, people usually don't vomit when they see me. 2 children walked in the door, saw me and vomited. It doesn't happen. Several of the kids walked in, they saw me, and they had to lie down, and they had stomach aches or headaches. You know, in other words, they were coming to tell me their true abuse stories, but they didn't really want to tell me their true abuse stories, and so they really got sick, and they found some way of communicating what had happened to them, or a little bit of that something terrible had happened to them. Basically, I saw these 20 children who had been sexually abused. I saw them one at a time. I met their parents as well. We knew they'd been abused. The lawyer knew they'd been abused. Parents knew they'd been abused. The kids didn't know they were abused. Some of them knew, some of them didn't. Basically, I thought there were kids who, when they were first, the abuse became known, which was 5 years previously, there were a group of children who said, yes, I was abused. Mm-hmm. And then when I met them 5 years later, said, no, I was not abused. There was a second group of children who said, no, I was not abused. And they continued to say they were not abused 5 years later. There was a third group that said, yes, I was abused, and continued. Let me see. I have the yes group. Yes, I was abused. Yes, I was a group. No, I was not abused. Yeah. Yes, no, and then and yes, I was abused, and no. Basically, what we found was so clear was that the kids who had been the most abused were the ones who were the most symptomatic, but who denied the abuse. And you knew they were abused because they were telling you they were abused in so many ways, like vomiting when they saw me, but also sexually abusing a sibling, or walking around and refusing to go onto buses. The abuse happened in a bus. I see children driven wrong. The abuse happened on a bus. They wouldn't go on buses. Kids had different symptoms, but it was very clear that they had been abused from their behavior. They were telling it from their behavior. So we were asking questions like, how is it that children who've been abused, why don't they tell? How do they tell? Why is it that children try so hard to forget? Because that's what was happening. And why is it that adults try so hard to remember? I mean, it was really interesting. But these kids were really telling their true abuse stories by their behavior, by the fact that they couldn't sleep, by their symptomatology for 5 years when I saw them. It was so clear what had happened. Not clear exactly what happened, but clear they'd been abused. And some of the kids could actually report what happened to the other children. The kids who'd been least abused, were the ones who could tell us their stories and tell us what they saw. The kids who'd been most abused wouldn't talk at all. But they wouldn't talk, and they would talk. They would say things like, when I get older, I'll be able to tell you what happened. Or, I wasn't abused. Well, maybe I was. Well, I don't know if I was or not. Or nothing happened to me. I just got very hot on the bus. It happened to other kids. And if it did happen to you, I wouldn't tell you. I mean, those are the kinds of things that they said to us. So it was very, very powerful. But that case really was an extraordinary experience to be involved with that. I really think it's important that analysts are involved. They're expert witnesses. We have something to offer. There had been such negative feelings about psychoanalysts in the, I would say, 70s and the 80s, we were hated. We were hated within APA. We were hated by the scientists. We weren't seen as real psychologists. We were seen as people who didn't do research. I mean, not that we had to do research, but we didn't know the research. We didn't know what we were doing. We were just making up stories. It was all fantasy. I mean, they were so anti what we were doing.
You know, I volunteered across the street at the rape crisis program at St. Vincent's, and I remember when they took me in, they said never ever refer to a psychoanalyst because the patient will be told it's in her head. So I'm just appreciating what you're saying about psychoanalysts not being trusted as clinicians in the field.
Isn't that
during that
incredible?
period.
Right.
Yeah.
And even within APA, there was such even all practitioners actually within APA were not trusted and were disliked. It was very extreme.
Yeah.
Really extreme at that time.
So, Judie, let me ask you, what would you tell, is there anything you'd like to say about the transgenerational transmission of trauma? You've written on this, you teach
Mm-hmm.
about it.
Mm-hmm.
How does it how is it part of this chapter? It's not a chapter, your specialization.
You know, I never could figure out why I was so passionate about trauma. I mean, I've been involved in all kinds of trauma of illness, trauma of sexual abuse, trauma of child abuse. I mean, I've just been involved in wife battering. I've been involved in so many areas of trauma, and I was trying to figure out why. Why was I so involved?
Mm-hmm.
And my mother gave me a gift. When she was dying. I remember this very well. This is generational transmission of trauma. Obviously, I had trauma, but I hadn't been aware of what the trauma was. Although once my mother told me, I knew. And what happened was basically, this is my transgenerational transmission of trauma. My mother was dying, and my sister and I stayed with her, and we kept singing songs, and we were entertaining her. She was in a great deal of pain. We were with her for about a week. And at the end of the week, my mother asked for some chocolate. My sister was out of the room. My mother asked for some chocolate. I happened to have some in my pocketbook because I was staying in a hotel. You know how in the hotel they'll give those little pieces of chocolate? So I had it, and I warmed it up in my hand, and I ran and got a Q-tip from the nurse, and I put that on her lips, and then she licked it, and then she said, "Oh my God, that was wonderful," and then she died. But right before she died, she gave me this incredible gift, and she said, "I was raped by the dress shop owner when I was 15. And suddenly, I mean, it was the most incredible experience because suddenly I understood. Once she said it, I knew I had always known it. But also once she said it, not only did I know I'd always known it, but suddenly my whole life made sense. All my passion, my professional passion, suddenly made sense. Anyway, I wrote that up for a conference that I think you were involved with too. I remember. And I wrote it up, and Sue Grant, I think, was the chair of that conference. And Sue Grant read the paper before the conference and said, "Go back another generation." And I said, "Sue, that's all I've got. I don't know anything about another generation." She said, "Get more information." So I began to interview all my aunts and uncles and everybody, cousins and whoever was around. And I knew that my grandmother had lost 3 children in Russia. And after 3 children died in a fire, she came to the United States and then proceeded to have 7 more children. But I didn't know what happened with those 3 children in the fire. And so I tried to find out. And what I was able to piece together, this was in Russia, in very like 1901 or something, what I was able to piece together was my grandmother had lived through the pogroms. And a lot of people don't know what pogroms are, but pogroms are basically when a group is attacked and they just kill people. This was a pogrom against the Jews. And what happened was, you think you could go to a policeman and ask for help, or a policewoman? You couldn't go to a policewoman because the police would say, "That's a Jewish store. Burn that one down. Burn that one down. That's also a Jewish store." And apparently, my grandmother's 3 oldest children were burned alive in one of the I guess, I don't know if it was a store or a home, but they were burned alive at that time. So that was my mother's legacy. My mother had that, and then I think that was translated to me as well.
Oh,
So,
what a painful story.
you know, once you know that, you kind of listen to patients with different ears.
Mhm.
You hear different things. You're able to somehow understand their experiences better.
And probably also go back and ask them about the generations before, the ones that they're really focused on.
Exactly, because you know
Yeah.
that's important to do.
Wow.
That's right.
Very powerful.
Yeah.
Tell us about your experience becoming a writer and a teacher. How did you find, I mean, here you are, you're a mother, you were married, you had gone to school. Tell us about your passion for writing, for teaching, how you made time for it.
Oh, gosh. Well, mind you, I have a private practice, too. I've always...
I know, I
Yeah.
left that one out. That's another thing you're doing,
Right,
besides
right.
being an expert witness and,
right.
you know, so,
Yeah.
and all the rest.
I mean, clinical work was always first for me, but somehow clinical work was first, and then I just felt like there was so much that needed to be said. Once I started to see the sex abuse stuff and the women's stuff, there was so much that needed to be written. So I just began to write. How did I make time? I can't answer. I mean, I don't know. But, you know, as I think about my career, I've done a lot. I really have. But it's a lot in 50 years of professional life. How did I get involved in writing? I wanted to know what I thought, and I never knew what I thought until I wrote. People would ask me questions, and I thought they'd be interesting questions, and I would write, and then I would figure out what I thought. So I found writing extraordinarily helpful, and in fact, I tell my patients to talk, but also to write. And I really encourage patients to write. And sometimes you figure out stuff by writing. And in addition, it's a way of, if you see a patient twice a week, it's a way of their kind of staying in touch with you every day, that they can write what they're thinking. So how did I get involved in writing? If you're in academia, it's publish or perish, and I chose to publish rather than perish. So that was part of it. Also, I think the personal is political. That the personal is, you know the phrase, the personal is political and the political is personal? Well, I think the personal is professional, and the professional is personal. So everything that I do professionally really relates to something about me, although it took me a while to figure that out. And everything I do professionally, everything I do personally is professionally. So writing about women, that was my life. I mean, dealing with women's issues and all the sexism that had been so much a part of my life. And I can't say I was a trailblazer, but I think about people who are 10 or 15 years older than me, who have PhDs, who have PhDs. How did they do it? I mean, I met with so much sexism. I can't figure out how they ever did it. I mean, there was so much that was opposing having a career and having a child and combining those two. There was so much that was against that.
Yeah.
So anyway, I wrote because I wanted to know what I thought. You know, and when I wrote, I figured out what I was thinking.
Wonderful. Wonderful. What would you advise candidates, you know, what recommendations do you have for our postdoc candidates as they're studying with us?
I'd like to tell a story about an Israeli and a Palestinian who I had in a class.
Yeah.
Because I'm concerned about some of what's going on now. But basically, around 9/11, I was teaching trauma. And every year that I would teach trauma on September 11th, I would talk about 9/11. I thought that was important to do. And one year when I was doing that, and I talked about the terrorists who went into the World Trade Center, a student said, excuse me, Dr. Alpert, terrorists? And I said, yes. And she said, that's not the right word. And I said, what word would you use? And she said, freedom fighters. And everybody gasped in the class. And I thought, and I said, well, this is a class not on politics, but it's a class which is really about trauma, and we really need to focus on trauma, so I'm not going to go there. And that quieted her down at that time. And then maybe about 3 weeks later, she came to see me, and she said, I'd like an appointment with you. And I always ask students, what do you want an appointment about? And I asked because I would know how much time to allot.
Mm-hmm.
She said, I want to talk to you about how much I hate you.
Wow.
Oh,
Wow.
okay. I think we need an hour.
At least.
So I scheduled an hour for her,
Mm-hmm.
and we met. And I said, why do you hate me? And she said, because you're Jewish. And she said, in fact, I hate every single Jewish faculty member in this department. I asked her why. And she said, I know what your politics are, and I know what your primary identity. And as it turned out, she didn't know what my politics were, and she didn't know what my primary identity was. My primary identity is that of a woman, not of a Jew. Not that I'm not Jewish, I am, but that's not my primary identity. So I told her that. And then I talked about different self-states. And I said, we all have so many different self-states. And you have a self-state as a woman from Gaza who grew up in Gaza. But you also have a self-state as a woman, not only as a Palestinian, but also as a woman. And can you begin to talk about what that self-state means to you? What are your associations to that self-state? And I had already done this with her, with my self-states. So she began to talk about how it meant she was tied down, how there were limitations. When she thought of her self-state as a woman, how there was infringement, how she couldn't do certain things. I mean, she just went on and on about the self-state. And she got in touch with something that she hadn't been in touch with before. And that was really important. Then I asked her, after we met for a couple of weeks and talked about this and her self-states, would she be willing to meet with the Israeli student? And I said I didn't know if the Israeli student would meet with her, but maybe the two of them could talk about their different states and get to know each other. Maybe that would be important. So she said she would if I met with them. So I said I couldn't meet with them all the time. I didn't know how often they would want to meet, but I would certainly meet the first time. And if they wanted to meet more, we'd have to see. So I met with both of them, and I suggested that they do a paper together, that maybe they could ask each other questions and answer those questions. No, I think what I suggested initially was, you've been through the same wars, because they're about the same age. Could you write about your experiences in each of the wars that you've been through? And she said she wasn't willing to do that, but they agreed to do Q&A, so that's what they did. They wrote questions to each other and answers, and it was very powerful. It was a really powerful experience. And in the end, after this very powerful experience, they wrote this paper up, and they agreed to read it to the class at the end of the semester, and everybody in the class cried, including me.
What shifted, Judie? What shifted?
What shifted? I think it was just getting in touch with their different self-states and talking about it. And I'm mentioning this in the context of your question, because I think we as psychoanalysts have to remember that we're psychoanalysts. And Postdoc is all about being trained to be psychoanalysts. It's not about somehow being political and using this as a forum for a political forum. And I think we have some real skills, and we can offer them to make changes in other settings. And it just breaks my heart that that's not happening. Mm-hmm. It just breaks my heart because we have so much to offer that could be so helpful to people. So
that's very powerful, that story.
So I feel that very, very strongly, that we haven't been doing what we can do, and we should be analyzing what's going on, and we should be somehow using our clinical skills to make a difference at Postdoc and at NYU and, in a larger society. We can do that, and we're not. So that's one thing. I guess the other thing is I would suggest that people, and Spiro would go crazy if he heard this, but take as long as they want to finish the program, because as long as they possibly can, just because you meet so many wonderful people. I mean, I had such a wonderful wonderful experience at Postdoc. I met such wonderful people, and I feel like they're my community, and I'm extremely grateful for the people I met, for the things that I have learned, for the community that was offered me. It's really been an extraordinary experience.
But I don't know that you're saying stay forever. I think you're saying try to immerse yourself into the experience. Just don't move through checking the box.
Okay, that sounds much better.
In other words, right? There's so much to learn and
but to meet as many people as you can, however you do that.
Yeah.
However you can do that. meet as many people as you can at Postdoc. Be open to meeting people, all kinds of people.
Yeah.
Yeah, but you're right. That's a much better way of putting it, and it's a much better way of doing it. You're right, Marie.
Yeah.
Yeah.